This is my student support system. Keep watching, keep learning.
Primary health center is a health facility which covers a population of 20,000 to 30,000. 20,000 population in hilly, tribal and backward areas, while 30,000 population in plain areas. PHC has the capacity of 6 beds for health services. 4 to 5 sub-centers work under one PHC. Staffing pattern. A medical officer is in charge of PHC. Each PHC should have approximately 15 staff, which includes one medical officer, one staff nurse or nursing officer, pharmacist 1, ANM 1, block extension educator 1, health assistant male 1, health assistant female, that is known as LHV is 1. But under NRHM, health assistant male post is abolished like MPHW at the sub-centers. So each PHC should have 2 LHVs. Okay. And under one PHC there are 4 to 5 sub-centers. So many times in examination it is asked one LHV supervises how many ANMs. So it is 4 to 5. Okay. Then UDC 1, LDC 1, lab technician 1, driver 1 and MTS staff 4. So total 15 staff should be there. Functions of primary health center. Functions of primary health center includes basic medical OPD services, maternal and child health services, family planning services, immunization services, provision for safe water supply and basic sanitation services, prevention and control of local endemic diseases, survey and data collection, health education to spread awareness, nutrition status promotion services, national health program activities, referral services, basic laboratory services, and training for ASHA and other local staff.
My student support system. Keep watching, keep learning. My student support system. Keep watching, keep learning.